Thanks for joining another edition of NutriRebel Red Pill Edition. So today we're talking about healthcare and socialized medicine, or free healthcare, whatever you want to call it, universal healthcare. And we see the contradictions. The contradictions.
I keep hearing this, like, Canadians are so nice. Canadians are so nice. They can be nice because they have healthcare. Because they have a government that cares about them.
When does the government care about us? What is the government anyway? I used to think these things. And this guy, for a living, as far as I know, he makes films for a living, for the masses, right? Dumbed down films for the masses, mostly comedies, I remember. And he's just a comedian, so he's just making fun of us. That's what he's doing. Governments care about us. And first of all, Canada doesn't have health care. We have sick care. And over the years, and still to this day, I still hear people talk about, when I tell them I'm from Canada, they say, oh, well, you don't have to pay for medical bills and things like that. I said, yes, I do still have to pay. But it's sick care. Major accidents, you might not have to pay for some of it, but for a lot of it, you still have to pay. Like ambulances, you still have to pay for ambulances. And we still have privatized healthcare there, like if you have work insurance. But your work insurance is not healthcare either. They're very limited coverage for modalities that actually treat your body like a botanist would a plant. This is a big topic for many people, and I used to be confused as well. I was totally confused, really confused. And I used to believe what my mother and father told me: get a good job that pays you benefits. That includes benefits, so they take care of you. I said, since when does your boss give a crap about you? I mean, this is just unbelievable. Just like that image before that you saw with the Antifa members, they're all dressed up like military people, and they're saying no, they have no hate signs. It's a contradiction. It just doesn't make any sense. Anyway, like I said, I was told all these types of things. I used to say parrot lines like keep healthcare public and all this stuff, and these vague words that I didn't know the meaning to, these vague terms I didn't know the meaning to, and I still didn't have, and I thought they were just coming up with solutions for all kinds of diseases, but I also thought that big pharma controlled things too. When I was younger, I heard that all the time. So I just totally confused young people. There's a lot of older people that are totally confused as well. I still hear people repeat these things that he says, that they don't know it's sick care, it's not health care, and they don't cover everything. And it's a lot more being cut and a lot more waitlist as each year passes by. We've had a crisis in Canada with healthcare or with sick care for decades, but yet they keep saying it's the best. They keep brainwashing us. That's all it is. They keep repeating things, and this guy helps cement it. I mean, it sounds good what he's saying. It sure does, but there's no details there.
It doesn't say sink or fucking swim, pal.
Right.
And I remind you that in this movement we pledged ourselves 50 years ago that we would provide health care for every man, woman, and child.
And this is Tommy Douglas. He's basically the founder of modern day healthcare or sick care in Canada. In the 1950s in Saskatchewan, he's a politician. Well, of course, he's a politician. He's doing things for votes. And they never explain why healthcare, why not just healthcare, why some things are so expensive, and why they can't make, and why they can't be reasonably priced. Because insurance companies, governments, and organized interests get together and they squash the little guy. And then the politician comes along and says, "I'm going to save you." But this politician is a little bit different because actually he was a socialist. He was a member of the NDP like 70 years ago. And the NDP hasn't really been socialist for about 50 years. And you will see in these videos to prove what I say. But I don't specifically say that, but you will see the contradictions that many people have. So this politician actually helped found orthomolecular medicine. Like, I think if you saw my previous videos, Dr. Abram Hoffer and the scientists and doctors in his circle in the 1950s and 60s, they were trying to establish what the framework for what was supposed to be the healthcare in Canada, not sick care we have. He wanted to make real healthcare by analyzing the body like a botanist would a plant, right? We don't get that. It's mainly just a 10-minute auto mechanic visit. You go in there and he give you a drug and you come back out and you go to a specialist. It's like a conveyor belt. Oh man, big topic.
Irrespective of their color, their
Oh,
race,
yeah.
or their
Sounds
financial
good.
status, and by God, we're going to do it.
Oh yes, and who's going to pay for it, Mr. Douglas? You know, I'm not saying what he's saying is totally wrong. He funded a lot of good things, but they're not socialist anymore.
made but never kept.
The system is really sick. And you can quote me literally.
And there's Dr. Abraham Hoff in the background. He's a medical doctor. He died about 16 years ago. And there's Tommy Douglas on the top right there.
I think the system is absolutely sick. And it has to be changed.
I say quit trying to give us a system and forcing us to adapt to it. Adapt your system to what we want and need and what we know.
What you want and need, yeah, for the individual. But what we have is sick care for the masses. Not even that. You can see from these protests here.
Healthcare workers,
it's going on all the time.
And politicians
even
came
before
together
Trudeau.
for rallies across the province today, including one right here in downtown Toronto to protest the Ford government's so-called inaction on the hospital crisis and attempts to privatize.
Fix it, don't sell it! Fix it, don't sell it!
And they call this healthcare, and you believe when your parents and clergy and all these people that are supposed to be adults telling you, get a good job, little boy. Be a slave to your boss. He'll give you some drugs to keep you at your job, and you'll be drugged up real good so you keep doing your job. Make sure you don't get into an accident though when those drugs destroy your mind and your body. Oh man.
Healthcare is flatlining, overworked, underpaid, overwhelmed, underfunded. Keep our healthcare free. Don't privatize. These were just a few of the messages members of the public delivered to the Ford government as they rallied on Hospital Row.
And this is what they used to tell me too. Oh, healthcare is public and free. You don't have to pay for nothing. That means you can eat all the junk food you want. And when you get sick, you go to the doctor, he gives you pills and surgeries, and he fixes everything up for you. I said, do you want to get sick and get those surgeries? No. I've already been through that. My parents been through that. People around me have been through that. They don't know this. I was confused. I didn't know what the solution was either. So that's why I'm now a practitioner for the real stuff.
It's just absolutely terrible, atrocious what they're doing. And right now, I'd be afraid to go into a hospital.
Yep.
We want to get a pharmacare program because
this protester wants to get a pharmacare program, free drugs. And these are the socialists that also claim that capitalism is the problem. Can you believe this? Can you believe the contradictions that we're seeing here? Let me say that again. These protesters say we need to buy bulk drugs for health care. That's not health, that's sick care. And that's acute issues, acute, not chronic, right? And then these are the same protesters that say they want to dismantle capitalism. They're confused.
we're the only country in the so-called developed world that has a universal health care program without having a pharmacare program. So we think it's very important. It would save a lot of money if we do it because we could buy drugs in bulk.
Well, see, there we go. There's the no hate signs. The Antifa members, these are guys who are supposed to be anti-fascists. And we see this contradiction everywhere. They're carrying around no hate signs, but then you see them whacking people over the head with the baton. Contradiction, I think so. And you see a lot of these contradictions in many people. They call you a label, but then they say they're about peace and love and tolerance and understanding. Can you believe this? Like this is the adults doing this. Therefore, the world isn't round. The world's effed. Yeah, I would say it is. And in these cases, we have to just try to pull back and.
Today, unfortunately, it's occurred that too often patients are not treated that way at all. They're badly treated, mistreated. They're forced to take injections against their will, even though that's against the law in Canada.
And there's Tommy Douglas on the top right hand. So forced to take drugs against your will for psychiatric. There's no psychiatric, no such thing. That's separating the mind from the body for a bureaucratic system, like a medical system that treats your body and life like a product on an assembly line. That's what it is. Oh man.
And the fourth aspect of treatment is what I call orthomolecular. They have to be given the right combination of nutrition, vitamins, minerals, and medication if necessary. But it has to be used carefully and always to make sure that the patient is not damaged in that process.
Those who think in terms of talking points instead of trying to understand realities make much of the fact that some countries with government-controlled medical care have longer life expectancies than that in the United States.
Yeah.
That is where the difference between health care and medical care comes in.
Yeah.
Medical care is what doctors can do for you. Health care includes what you do for yourself.
Yeah, that's right. Such as visiting the link at the bottom left to get a free symptom measure tool assessment. It's no obligation, and there are or visiting not a holistic, I call it integrative practitioner But they are also limited if they're under insurance, or if they're registered under some bureaucratic organization like a licensing body. They are severely limited what they can do and say.
Such as diet, exercise, and lifestyle. If a doctor arrives on the scene to find you wiped out by a drug overdose or shot through the heart,
that's acute. That's what doctors are trained in. They're not trained in chronic prevention and restoring your health. Not much at all.
By some of your rougher companions, there may not be much that he can do except sign the death certificate.
Insurance companies are there to make money.
Yeah.
And they make a lot of money. And it's because of how the system's set up, guys. Your insurance companies, the pharmaceutical companies, and the medical world, they all work together for one primary goal.
There you go. And we wondered why healthcare was so expensive maybe 70 years ago, where the politicians said, oh, let's use this as a way to get elected. We make things free for people. And the people say, wow, he saved me. He saved my family. No. In the long term, he buried your grandkids.
To make money, not to be healthy.
No, to get you well.
No, guys, we're the sickest country in the world by far.
If you had a house plant,
and I continuously, quite frequently, play Dr. Bradford Weeks, MD, him talking about a house plant, because that's the way we need to get our medical care. That's the way it should be, but it's not.
And it was kind of fading green. You would think, is there too much light? Is there too little water?
Yep.
You would look to see if there's toxicities involved or deficiencies. And we all know that. And so why do we lead with an expensive pharmaceutical agent when we wouldn't do that with our plant? We check to see the water and check to see what the light is. So it's not really discovering orthomolecular work. It's really remembering that that's what we should be doing all along.
Yeah, and there's Tommy Douglas. Tommy Douglas used public funds, taxpayer funds, to research what the modality that he speaks of. But it only stayed in the naturopathic realm. However, or alternative medicine. These are the big, wide-ranging term, right? You have to look at the details. You can check all these things on my website and my other videos. It's a little bit confusing, but it's not so confusing. When its basic end of it is what he says: treating the human body like in lifestyle and condition like a botanist would a plant. Therefore, if you love my videos, which I hope you do, please like and subscribe my videos and spread them. It would be helpful.
you